My name's Duncan. I'm a GP in Erewash. I work in Long Eaton. Actually, I live there, and my kids go to school there as well. So I'm quite invested in my local area and the community too. And I work 8 sessions, clinical sessions as a GP, and I chair the GP Federation, and I'm clinical sponsor of Wellbeing Erewash. So I have no spare time at all. But one of the things that really motivates me, and I think Gary, Joy and Tracy have all sort of made reference to it, is this idea that my kids go to school and they are half as likely to die prematurely as other children in their class. So the kids in their class that live about 400 or 500 metres away from the house that I live in are twice as likely in their lifetime to suffer from a serious long-term condition and twice as likely to suffer from a premature death as my children who are 6 and 8. And that's a real motivator to say it's just not right and it's not fair. And it's on us as leaders of whichever organisation you belong to try and do something about that and make some sort of difference. We've heard loads about the organisational stuff, and whilst this slide wasn't designed to talk about it, so this is the internal working of a clock, and I can assure you no one can tell the time from that. And some of these system-wide changes feel a little bit like that to me because I am a GP. I'm not great at all the organisational stuff. But what's really important is our patients look at health, they look at social care in a really similar way. So they look at it and just can't understand how to get through it. And one of the things within Erewash that we spent a long time doing is trying to simplify that and make it more simple for patients. So this isn't about generating additional services to make other sort of routes of access for patients, for whatever the current word is, they're going to be patients because I'm a GP. And I thought the best way to summarise it, rather than what I was planning, was just to tell the story of someone that I looked after quite recently. This is a chap who had a cancer that had spread around his body and he was going to die. He was going to die within the next couple of months. And so when I visited at home, it was really clear that he didn't want to die in his own house. His wife didn't want the thought of him dying there and then having to continue living. So it had been planned that he wasn't going to die there. And so when they recognised that he was getting worse, he was going to move into a nursing home where he would want to die and then be looked after in that nursing home. And were it not for the services that we provide as GPs, but also every other provider made available, we wouldn't have been able to make sure that that person had the death that he and his family wanted. So just to run through some of them, when we first spoke about him dying, I was able to go to our community delivery team. So this is a meeting fortnightly where we have the community services, physio, OT, district nurses, the community matron, social care there, so we can make these plans. So when we recognised that this chap was starting to die, we could actually get those plans in action and do something about it very quickly. And rather than me, which was the traditional role of the GP, making those phone calls after that visit once it had been recognised, so phoning up social services, waiting on hold, trying to phone up a nursing home, phoning up the family, we were supported by a care coordinator. So I was able to speak immediately to Michelle, and Michelle within 4 hours had arranged transport and an admission into a nursing home for this guy. The real bit that makes a difference, and Joy alluded to it, with the lack of support from primary care to be able to make these services work. The reason I was able to go and visit him at home and I was able to deliver continuity is because as sort of the local areas, Wellbeing Erewash, we'd invested into primary care. We invested into an acute home visiting service, which took away the lower acuity patients, so the less complex patients, which meant that I could plan to go and see this guy. I can make sure that I had time with his family and his wife and his daughter to make sure that they knew what we were trying to do. And I had time at the lunchtime to sit within a community delivery team, so to sit within this multidisciplinary team to make those plans so that when it happened, we were able to look after him. And the patient and his wife and his daughter saw absolutely nothing different as a result. They phoned up the GP surgery, they phoned up my practice to get help. They didn't have to have separate numbers, they didn't have to have anything different. And we had myself, so our general practice, we had DCHS and we had DHU, all providing those services, all delivering them in an entirely joined up way, without any organisational change and without any change in governance structure. And I think for me that seems to be the fundamental thing. Tracy mentioned about the importance of sort of crunchy financial levers and the organisational or governance structure. And I think that's really important. I think where we are in error wash at the moment, we ignored the governance and the organisational structures for the first 18 months. And we asked clinicians and we asked patients and we asked the communities what they needed and what was important. And we heard that we wanted better integration of the community services. We heard that GPs were under real pressure, particularly under low acuity reactive demand, which meant that they weren't able to deliver proactive care. We heard that the administrative burden placed on practices and on community services in coordinating care and delivering it was really difficult. And so we developed services to meet those problems, which had come not from senior managers and directors, but had come from listening to frontline staff and patients, and we made those differences. And then we spent about a 4-month period looking at organisational structures and what we needed to do, and realised we couldn't agree on what to do. So we knew that we had to take a different step forward, and we carried on moving forward. And it's only now, after about 2.5 years, that we're looking at how are we going to have a shared governance structure. And we've managed to deliver this terrific change for patients in spite of our organisational loyalties and in spite of our separate governance structures. And I think for me that's the real key, and the really important thing is the only way we can move forward with delivering an SDP, the only way I can try and make sure the kids in my son's class might have about the same life expectancy is by actually doing something for them and listening to the people around them. So there's my clock face, which is how I see the SDP, but I am more optimistic. But I think it's also how most people see the services we provide. Now it's coming up to Easter, so I thought, oh, a nice pretty Easter picture, but there is a bit more to it than this. Does anyone know how long it takes a hen's egg to hatch? No, I thought someone would know. It's 21 days. And does anyone know how you can make it hatch any quicker? Yeah, and so if we warm it up, we will probably end up with a cooked egg. Well, so I suppose that's the question is, I don't think it would make it quicker. So we could push really hard against it to say hurry up and keep on sort of moving it around, and then we'd probably scramble the egg, and we could really put the heat on it, and we'd cook the egg. But the only way we're really ever going to get that egg to hatch, and the only way we're really ever going to deliver anything, is if we provide the best possible conditions for it and be patient. So we talked a lot on our table about the importance of engagement, the engagement with different members of staff and with patients and communities. They are the perfect conditions, and I think as leaders we need to be patient to make sure that we provide those conditions for our egg and just accept that it might take 21 days for that egg to ultimately hatch.